ನಮಸ್ಕಾರಗಳು ಎಲ್ಲರಿಗೂ. This is Dr. Manjunath Awadkhan. Welcome to my YouTube channel again. Let's learn medicine together and in a very simplest possible way. Today I will be discussing about rule of 3 in CBC. CBC is the one of the most common blood investigation done in OPD as well as IPD basis. So we clinician must know in and out about CBC. CBC is not just a HB total count, platelet count. We need to know indices, all other parameters of the CBC. In CBC report, every parameter has a meaning. So whenever you are reading CBC report, read all the parameters and interpret the same. Coming to rule of CBC, rule of 3 of CBC. Usually hematocrit is 3 times of HB and HB is 3 times of RBC. For example, if HB is 10, hematocrit will be 30. If HB is 15, hematocrit will be 45. And if RBC 4 million, HB will be 12. And if 3 million, HB will be 9. Clinical application of the rule of 3. If hematocrit is not equal to HB into 3 plus or minus 2, then it is abnormal. That is abnormal. If hematocrit more than HB into 3 plus 2, suggestive of decreased plasma, that means hemo concentration. The hemo concentration usually seen in dengue and dehydration. Hematocrit is used to titrate fluid in dengue. For that we need to have a baseline hematocrit, and after that we need to monitor patient clinically as well as hematocrit and urine output. According to that we have to titrate the fluid. Increase in hematocrit by 20% is a warning sign of dengue. That means patient is in leaky period, fluid is going out, plasma concentration is decreasing, plasma volume is decreasing in the blood vessel. Patient may go into shock. For that you have to act immediately. So you need to increase the fluid at 6 ml per kg per hour and target urine output 0.5 ml per kg per hour, and after that titrate accordingly. So here is a patient of dengue who has come in a leaky period, whose HB was 10.8 and hematocrit was 37.7. So we calculated HB into 3, to which came 34.4, which is pretty less than the patient's hematocrit. That means patient is in leaky period and has a hemo concentration. Need to increase the fluid. So we increase the fluid, and after that increasing fluid we repeated a CBC, to which has shown improvement. HB is 10.3 and hematocrit is 31, pretty normal. So our doctor has decreased fluid to 4 ml per kg per hour again and monitored urine output. If RBC into 3 is not equal to HB, that means that is abnormal. In iron deficiency anemia, hemoglobin decreases as well as RBC also decreases. RBC into 3 is equal to HB is maintained. For example, HB is 9 here and RBCs are 3 million. That means that is maintained. Anemia but RBC count not dropped. In this case we suspect thal rate. In thal rate, RBC into 3 is more than HB. So here is a comparison table showing IDA and beta thal rate. The hemoglobin is almost same in both, but RBC count has decreased in according to the HB in IDA, but in beta thal rate RBC counts have not dropped. It is maintained above 5 million. Any RBC more than 5 million per microliter in a child beyond infancy should alert pediatrician. To differentiate between the iron deficiency anemia and thal trait, we use Menzer index. Menzer index is a ratio of MCV in femtoliter divided by RBC in million per microliter. So here is a case case 1 and case 2, who both are anemic and both are microcytic hypochromic. So here we need to know Menzer index to differentiate between whether it is Thal trait or iron deficiency anemia. So we calculated Menzer index in the first case, which one came 21, and Menzer index in the second case was 9.4. So Menzer index less than 13 suggestive of thalassemia, more than 13 suggestive of IDA. Thank you.